We are hopefully going to vote today on this bill and these amendments, but we'll figure this out if we don't have quorum quite yet.
Okay, thank you.
Yep. Great. Hello, everyone, and good afternoon. Welcome to the inaugural subcommittee meeting of the Elder Care and Long-Term Care Subcommittee. We have one bill on our agenda today. It is House Bill 278, and it is a departmental bill that aims to codify Longevity Ready Maryland, which is an executive order that comes from Governor Moore. So, Lisa, can you describe the bill and the 4 amendments that we have today?
Sure. So this is a departmental bill, and like you said, it codifies the Longevity Ready Maryland Plan. It requires the Secretary of Aging to lead implementation of the plan with the goal of building a longevity ecosystem, promoting economic opportunity, preparing state residents to afford longevity, and optimizing health, wellness, and mobility. By July 1st, 2029, and every 4 years thereafter, the Secretary must provide the Governor and General Assembly with an update of the plan, and by January 1st of each year, the Secretary must report to the Governor and General Assembly on specified activities of the plan. The bill also alters the membership and duties of the Commission of Aging. And the amendments that were sent out to you, they clarify that the programs and services the Secretary is required to coordinate, assess, and evaluate in implementing the plan, that they should be designed to assist independent living. The Second Amendment requires the Secretary to maintain a publicly accessible progress tracker for the plan on the department's website. And the Third Amendment requires that each updated plan be informed by other relevant state and local plans and agency collaborations. And it alters the membership of the Commission on Aging by adding 2 for a total of 3 directors of the area agencies on aging. It adds an expert on consumer protection, and it adds a veteran.
Thank you, Lisa. Before I open it up to discussion of members, I'd love to get any insights or thoughts from the Department of Aging about the bill. And we've heard a whole briefing about this in addition to the bill hearing, so our members should be pretty well versed in it. But for the sake of everyone's for the good of the, how does that expression go? For the good of the whole, whatever it is, you know what I mean?
The good of the whole.
There we go. Share your comments, Andrea.
Hey, good afternoon, everyone. Can you hear me okay? Chair Lopez, we are thrilled to be here. And this inauguration of this subcommittee is a happy one for us. We're thrilled. And thank you to Lisa, Chair, all of you, for our bill getting to be heard in the first meeting of this subcommittee of this session. So to keep it really brief, I think for this, again, the goal of the plan is long-term, as you heard in a briefing already, members, and our bill hearing. This is at least 10 years of work that we want to do together with you all, restructuring the agency to do that at no cost to the state. Updating the Commission on Aging and building in, this publicly available tracker, progress reporting every year, 4-year updates, and just kind of really building this structure of the department and planning to live a long life with us. The amendments you received that Lisa took you through, thank you so much, represent consensus. We were pleased to work with ANSICOT and the AAA's Association of Maryland and some other stakeholders on those, and definitely we're happy to see those move forward, hopefully. I'll keep it there, Chair Lopez, unless I do have my Deputy Secretary, Jennifer Crawley, here. If anyone, we're very happy to answer more questions, talk more about the plan, or leave it there, whatever you guys would like.
Yeah, thank you, Andrea. Jennifer, do you have anything to share for the good of the order? That's what I was looking for.
Good morning. Just to echo what Andrea shared with you, thank you very much for moving our bill forward, and we're here to answer any questions, and we appreciate the partnership with the area agencies on aging and our other stakeholders across Maryland. Thank you.
Thank you, Jennifer. Any question? Oh, Terry Hill, Dr. Hill.
All right. Thank you, Madam Chair, and thank you all for the plan. I understand it's a aspirational long 10-year implementation plan. When I was listening to the hearing, there were a couple of concerns that I'd like you just to clarify. One, I'm not clear on what is going to be continued during the implementation period. There were some things that were removed in the statute on page 3. And my particular concern are, for instance, the NANA grants, which it's a grant program for community-based organizations that help people age in place. Not clear to me that those are going to be continuing during this implementation. It's not clear that the list of senior citizens that you all have been providing, that you'll continue to do that as this is rolling out. And again, I just need some clarity on as you implement this, should this bill pass, what will we continue to do, particularly since there is a large deletion in the bill specific to programs.
Go ahead.
Good afternoon, Delegate Hill. Thank you so much for that question. And I recall from the hearing those same concerns. To provide further clarification around what we did and the intent of this bill, first of all, the NANA grants, we love those. Those are, they help facilitate aging in place, also help to support villages across the state. There is no intention to change that unless we are able to get more funding for it. So please rest assured that this bill and act does not do that whatsoever. What we did do around the page 3 and where all of those various services are identified, some of that language is actually outdated. Like as an example, income maintenance and things of that nature. Those are actually, that's sort of older terminology that is reflective of the time in which these statutes were originally written. What we did was we actually looked at the Older Americans Act final rule, and that was published in 2024. Originally, that legislation is from 1965 and has had several, kind of updates. But the most recent final rule update had the Older Americans Act had not been updated in probably 20 to 30 years thereabouts. And so in the same spirit, the Older Americans Act was also updated to reflect more current language, more current systemic-wide issues, recognizing that our older adult population is growing, and we're at a very different place than in 1965 when the Older Americans Act was initially established. So with that being said, the Older Americans Act actually speaks about developing systems and using Older American Act dollars to catalyze more services, programs, presence for older Americans, caregivers, and their families. And so no change in terms of the population who we serve. It just becomes a little bit more broad. We also took language specifically from the Older Americans Act and said that to implement the Longevity Ready Maryland Plan, the Secretary shall, and that talks about, everything that the Secretary will do. And then specifically around those areas, we say those services are designed to assist older individuals and family caregivers in leading independent and dignified lives in their own homes and communities. That is essentially paraphrased directly from the Older Americans Act, and we see that as being much more broad.
A follow-up question, Delegate Hill?
Yes, thank you. That was helpful. Can you show me where in the bill is that language? Because I wasn't able to find it.
Yeah, it's also on, I believe it's still page 3 in the drafting, and it is, yep, page 3 under, I just want to make sure I give it, under 4, optimizing health, wellness, and mobility. And then it's D, to implement the Longevity Ready Maryland Plan, the Secretary shall. And you can see like under number 1, evaluate the services needs of, and we take out seniors and utilize older adults. And that's
Right.
similar to what we've been doing as a result of our Reframe Aging work. And then it is actually section 2 under D.
The language you said for living in their home, the independence, where's that language? I didn't see that language that you lifted from the Older Americans Act.
Yeah, on
Some language, I don't see it here.
Are you looking at the reprint, Delegate Hill?
Looking
Or?
at it, policies, institutions, and systems support older adults, establish priorities for meeting the needs of older adults, and coordinate subject to existing law, assess, evaluate, and educate public and professionals about all state and local programs and services, both public and private, that are relate to and are important for the well-being of older adults.
And then it's the next one. There,
And
you should see
and then that's the
2.
stuff that was taken out.
No,
just above that.
You're not
So
looking
on
at the
page
reprint
4.
that was sent around.
I see on page 4 where it continues.
No, the
Portable.
reprint that was sent around, though, that was emailed, should have a right under on page 3, right after line 15. There's a Roman numeral 2.
Okay, so I'm missing. All right, I will look for that reprint. Okay, so it wasn't in what we had at the bill hearing, because that's what I was referring to. Okay.
Correct.
All right, I'll look
That's
for that.
correct, Delegate Hill. That was,
Yeah,
sorry,
Delegate
I
Hill, we can-
apologize if
So
there's
that's one of the amendments? Is that what that is?
Just a
Yes.
sec, Delegate Hill, we'll forward you a clean copy.
Very
If
good,
you just
thank
want to
you.
look midway down on page 3, it says it very clearly.
Okay, is that one of the amendments?
Yes.
All right, thank you. All
Mhm.
right,
Yeah,
Thank you.
Amendment 2,
thank you.
2 of 4.
Got it. All right, appreciate it. Thank you. Well
Yeah,
done.
no,
Mhm.
no worries. Yeah. Any of our delegates have questions or want to raise concerns for discussion? No, any thoughts to share? Nothing? All good? Okay. Any folks from our advocacy community want to share comments about amendments or the bill as drafted?
Madam Chair, Ann Seacott here for the Maryland AAAs. Just a thank you to the department for working with us on the amendment, and the amendment around local plans, and we're very pleased and we appreciate it, and go ahead and give it a thumbs up.
Perfect. Thank you. That's great feedback for our first bill out of the gate. All right. Anyone else?
Madam Chair, this is Sarah Westrup with AARP Maryland. Just wanted to offer our support for all of the amendments. And thank you again for leading this hearing. And thanks to the Department of Aging for the Longevity Ready Maryland Act.
I'd
Wonderful.
like to move the amendments if we have quorum.
Sure. I just got a text from Delegate Morgan's staff. We're going to make sure that she gets him on in a second. Let's see, Emily, just one sec. Just email Matt Morgan. One second.
Thank you. That's not the real thing. Yeah. Hold on.
There we go. All right. Lisa, we are, Mr. Benzer, would you like to, I see your hand up.
Yes, I just wanted to say what my other colleagues said, that it's very nice to be a part of this. And at the end of the day, successful aging requires that the right services reach the right people at the right time. And we're just glad to be part of this forum and to be able to collaborate. So thank you very much.
Yeah, well, thank you for being here and thank you for all that you do. All right, I think we're in a position to be in quorum. Right, Lisa, am I violating any rules here?
I think you're
It's
good.
such a small group, right?
It is. Well, is Delegate Warman actually with us? That would.
Yeah, I'm
She-
here.
Oh,
Okay.
perfect.
Didn't see you, so I wanted to make sure.
Sure, and I think there's just a scheduling problem with Delegate Morgan, so hopefully he'll be joining us in just a minute. And I don't want to move forward without giving his input. So perhaps we can vote, and then I can follow up with him later in case he has questions, because I don't want to hold this up too much. I understand there was a motion on the amendments. Is that right, Delegate Hill? Is that motion seconded?
Second.
Oh, and I see Malik from Delegate Rosenberg's hands up.
Yes, if you just give me a second, I'll get my laptop to the delegate so he can participate in the voting.
Okay, perfect. So more than quorum. We'll be good. Thank you, Delegate Rosenberg. All right, all those in favor of moving the amendments favorably? Indicate with an eye or a hand up. Delegate Mormon. All right, passes unanimously. Is there a motion on the
Bill as
bill?
amended. Move the bill as amended.
Is there a second?
Second.
All those in favor say aye.
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 There we go. Perfect. The bill passes favorably out of subcommittee. Delegate Hill, I see your hand up. Is that a
That was a
doubling
vote.
down on favorable?
That was a vote.
Okay, perfect. All right, well, look at that. Even though we had a few little hiccups, we just passed our first bill out of subcommittee. Thank you all for giving me such great confidence in chairing this subcommittee moving forward. We've started on a good foot. Okay. Any other comments for the good of the order?
Move to adjourn.
There we go. Thank you. Is there a second?
Thank you.
All right, that's good enough for me. All right, everyone. See you in like
Thank
2 minutes.
you.
Thank you.
Bye.
Bye-bye.